the system that I use is rapid cellular balancing. I developed this by bringing together all the scientific contributions of the German doctors. Okay. Dr. Wilhelm Schuller, who introduced the biochemical medicine worldwide, Dr. Hans Rest, and Dr. Otto Warburg, who introduced the electron transport chain. So, by bringing together the scientific contribution, I was able to develop the rapid cellular balancing. Now, the rapid cellular balancing is a system whereby it enhances aerobic glycolysis. In the body, we have glucose, sugar, which in the absence of oxygen is converted by fermentation process into energy. But without oxygen, the energy that you get from sugar or glucose is only 2 moles of ATP. But in the presence of oxygen, you can get additional 30 moles of ATP. Adenosine triphosphate moles is a measure of calories and energy you get for every gram of either carbohydrates or sugar. Okay. By the way, cancer thrives on anaerobic glycolysis. So cancer thrives, but the normal cells cannot be sustained by anaerobic glycolysis. That means cancer wants it to be out without oxygen. But in the presence of oxygen, the Krebs cycle will move, the electron transport will move, and cancer will stop growing. Okay, that is the system that I use, rapid cellular balancing. And then for every step in the RCB, about 9 steps, for every step, substrates are produced. What we call Krebs cycle. Every step there, and every substrate is needed to produce antibodies, to produce hormones, okay, to produce enzymes, and every step should be needed to enhance stem cell production in the body. So you could say that with my system of management, I could enhance stem cells. Well, that is an overview, no? If you'd like to know more about that, you have to see my 2 or 3 hours lecture about that. This is only a summary that I'm giving you. So that is our RCB, rapid cellular balancing. Why is it effective as stem cell enhancing? Because it can boost the cycle, and for every step of the cycle, it will release a lot of nutrients produced, allow production of antibodies, hormones, enzymes, and even enhance stem cells out of this. Okay? Now, on the electron transport chain of Warburg, if you can move the electron transport chain, the result is many diseases, even affecting muscles and nerves and brain disorders, can be healed. So that is the role of RCB. It will take time before medical science, I know, would approve it, but theoretically it's already approved by 3 German doctors, which 2 of them are Nobel Prize winners, Otto Warburg and Hans Krebs. And one is Schuller, is a well-known cellular, the father of biochemical medicine. Okay? Now, what do I mean by stem cell enhancing effect? There are stem cells. These stem cells are young cells which have many potential. But as stem cells, they are like baby, like this. They cannot wash. Right? They cannot work. They cannot go to the office. They cannot operate the computer. So these are like stem cells. But when the stem cells mature, they become functional. That's called differentiation. When the baby matures, the baby becomes like the mother. Okay? You understand? The same thing is with the stem cells. We have stem cells called young cells, especially. We'll not talk about embryonic stem cells, okay, which is pluripotential. That is, every cell in the embryo, 5 days embryo, can become heart, can become brain, can become liver. Just imagine, one cell has a potential to become anything under the sun. That is what you mean pluripotential. I'm not talking about that. I'm talking about adult stem cells. Bone marrow is an adult stem cell. Bone marrow has 2 types of cells, mesenchymal cells and hematopoietic cells. The hematopoietic cells in the bone marrow can differentiate to become red blood cells, to control anemia, to a year, we can control anemia very fast. White blood cell to, that's what goes cellular immunity, to fight bacteria and virus, engulf them and digest them. Right? That's why if your stem cell is low, you can fight diseases. And to produce platelets are required to prevent bleeding. Okay? When they calculate, they prevent bleeding. So if you lack platelets, you will have problems with thrombocytopenia, low platelets, and you're prone to bleeding. Or if your platelet is low, you get dengue. Okay? I can be bitten by the mosquito causing dengue. I will not get dengue because I can produce a lot of platelets. Okay? So that is from the bone marrow. And the bone marrow has mesenchymal cells that can become bone, cartilage, fats, connective tissue. Could you imagine that? If you can enhance this bone marrow, you will have enough red blood cell, white blood cell, platelets, bone is built, cartilage, no more problem, no more rheuma. Okay? So, and connective tissue. So, you solve many problems. That's why they're called stem cells. From young cells, stem out mature, functional, or specialized cells. Okay. Well, of course, we have young cells in the brain, and they can mature to become neurons. These cells can conduct impulses like electricity. Okay. And then we have also oligodendroglיה cells, oligodendroglia, which are non-neuron cells. In the skin, we have also stem cells, which, if they can be enhanced, our skin from senior citizen will become junior citizen. Kung matanda kayo, pag tingin mo sa salamin, naging lalaki. Makikita ko sa inyo. Then, we have stem cells. Now, example, bone marrow can differentiate into what is destined to be. But in special circumstances, most likely with the use of rapid cell balancing as stem cell enhancer, the bone marrow can become spinal cord cells to repair damaged spinal cord, which causes paralysis. Okay? It can become part of the brain cells. That is what we call trans-differentiation. I had a case from Las Vegas, Nevada. She could not walk for 15 years. She could hardly walk. Her spinal column is badly damaged. Okay? And that was her problem. She was treated for spondylitis, spondylolisthesis. I just won't explain that anymore. She was treated by, of course, doctors in USA for almost 15 years to no avail. So this decided that she would come to the Philippines. Then the doctors there were shocked. You mean to say you're going to the Philippines? The Filipinos, they come here. If they have problem, why are you going there? Well, I have to go. Then she decided to come here. I treated her. Would you believe? The next day she's walking already. And grabe po. That's why I received a lot of emails coming from Las Vegas. Ano ba yung sa computer? Lahat yata ng mga nakalista, forward yung results niya. So, these are miracles of stem cell enhancing, which I achieved in this clinic. I would say it will take time before this can be approved by medical science, but I would say again, it has been quote-unquote usually approved by the inventors themselves. Okay? Schuller, okay, and Brett, and Werber. All their doctors. So, to show to you the effect of this RC, rapid cellular balancing, I have to show you the results, okay? This is a case of even cancer can be improved. Yesterday, I didn't have this picture. There was a cancer patient, Mr. Cecilio Malong, yesterday. Last Thursday, I talked at the Philippine College for the Advancement of Medicine. Sino po nagpunta ko? Wala. Last Thursday, right? Yeah. Yeah, good Filipino. Okay, nandun si Mr. Cecilio Malong. Okay, he was predicted to die of cancer, stage 4 liver cancer with metastasis to the lung. Okay, he became very, very thin. He lost appetite. No no appetite for several months. So he became very, very thin. And according to his doctors, one of the well-known doctors here, hindi niya sinabi ay. We don't know, but the top hospital in Manila said, Mr. Malo, your condition is so worse already, advanced, that it will be better for you not to undergo chemotherapy. Because you have spent almost close to $1 million, and the only guarantee is for you to live for 3 months. Why not just prepare for your funeral? It will be cheaper. Like maybe 50,000. For chemotherapy, $5 million. So they are preparing for his funeral until, remember he was there, so until he came to me. I treated him without appetite for several months. Then he said, after I received the RCB, I was hungry already. And then he began eating. Of course, if you eat, everything can be healed. No eating, no eating. Right? No appetite, you will be there. Now he was there. He gave his and then another one, of course, you saw him. He was yellow, green, right? This is good, yellow. Okay? And he was also very advanced. And the doctor from UPPGA says the only solution, if that's definitely cirrhosis, because it's very, very yellow, they cannot do anything. Nokia. Yung iba, hindi ko hindi ko yung matatak, Samsung. Okay, kahit Samsung. Kung masira ang Nokia nyo, ipaparepair nyo ba sa Samsung? Hindi. Kung masira ang Samsung, ipaparepair nyo sa Nokia? Hindi rin, di ba? So that means, ang magre-repair ng cellphone nyo kung nasira, doon sa gumawa ng cellphone. So kung nasira ang katawan natin, sino mag-repair? Okay? Sino mag-repair? Only God can do that, right? So, we have to look at the Word of God. What does God say regarding health? Para mabilis ang repair. Sabi ng isang Harvard doctor. This is a Harvard doctor who said, he once said, a degree in medicine without an appropriate degree in theology is inadequate. Sa Tagalog, ano yung Tagalog? Ang diploma sa medisina, kung walang kaugnay na diploma sa teoloya, sa Biblia, ay salat. Tama ba yan? Salat. Hindi naman ako sa yan. So now let's look at the Word of God. Okay, now let's look. So what does God say about health? Then he said, he declares in heaven, so that you may live long in the land that I'm going to give you to possess, a land flowing with milk and honey. Deuteronomy 11, verse 9. So ano yung sabihin nyo? Longevity is connected with milk and honey. And the people drank milk, and they ate honey, and they lived for 900 years. Walang heart attack, walang stroke, walang cancer, walang skin disease, walang kahit anong stress, right? So God, in effect, says, milk and honey can prevent all diseases. Milk and honey can treat all diseases. Do you agree or not? How can you disagree? He's a creator. He said that, right? Now, but you must qualify. It must be milk that is unpasteurized, unheated. Because if the milk is pasteurized, many things have changed already. And it should be honey that is wild and unpasteurized. What do I mean wild? No sugar has been fed to the bee. Because if you feed bee sugar, it's no longer 100% wild. Remember, wild honey, cancer will die. But if there is sugar in that, cancer will live. Diabetic patients, wild honey, blood sugar will normalize. With sugar, blood sugar will rise. So, maraming magiging effect. Okay? The wild honey should be like this. It should be wild and pasteurized. Now, I will check this so that you will know how to determine what is wild and unpasteurized. What is pasteurization? Heating milk up to 70 to 75 degrees centigrade, temperature for 20 to 30 minutes. And that was developed by Louis Pasteur. Okay, we'll check this now. Okay. This contains antibodies against many bacteria, virus. This contains antibodies, right? It fights bacteria and virus. No bacteria, bad bacteria will contains probiotic. When you say probiotic, that means pro-life. That means it contains good bacteria that will inhibit the growth of bacteria. You understand that? That is the importance of pro-life bacteria. Lactobacillus, bifidobacteria, pro-life bacteria. And then, honey contains 4 ingredients, caffeic acid, that can kill or inhibit the growth of cancer. So that's how important honey is. Even respiratory problem can be treated by honey, including tuberculosis. Okay, if you have problem with rheumatic fever, just take honey and milk, and the fever will disappear. The problem with rheumatic fever is infection of the throat, streptococcal infection. That streptococcal infection generates antibody, streptomycin, to destroy that. But the antibody destroys the heart, causing valvular damage, rheumatic heart, and the antibody destroys the kidney, causing glomerulonephritis and kidney failure. Now, how can you prevent streptococcal sore throat? You need honey on your throat. Honey will wipe away all the bacteria on your throat with unpasteurized. But that's honey, right? Any wound can heal with honey. Surgical wounds, I tried this. After operation, I had it tried. Sa mga cases with, yung mga obstetric patients, I told them, apply wound on the surgical wound. It heals. Okay? So it's good for fast healing. As you see, it's bubbling right? That is wild honey. It should be unpasteurized. If it is pasteurized, it won't bubble anymore. That means all the good bacteria are dead. If all the good bacteria are dead, the bad bacteria can come in. That's why honey is not allowed for babies up to 2 years. Because the babies, it can be contaminated by botulinum, and it can cause paralysis to the baby. But it doesn't happen if the honey is wild and pasteurized. The good bacteria will prevent the growth of botulinum toxin. Okay? Another thing is, this is the milk. This is exactly the honey that Abraham, Isaac, and Moses and Jacob ate. You see, it bubbles, right? Now this is the milk that they drank, unpasteurized. Okay? So what's the big difference between unpasteurized milk and pasteurized? Remember, pasteurization is heating the milk up to 75 degrees for 20 to 30 minutes, right? Now, then we also have sterilized milk. That is heating the milk up to 120 degrees centigrade. We also have UHT, ultra heated, heating the milk up to 160 degrees. So what happened to the milk when it is pasteurized? A study was done, published on the Journal of Nutrition, Clinical Nutrition in America, on cats. They found out if cats were given unpasteurized milk, they are well behaved. Well behaved. But if they are fed, they drank pasteurized milk, or maybe worse, sterilized or UHT, they become very, very wild. Hindi na sila, they are no longer cats, they are now called wild cat or musang. And they begin to bite and bite and bite. Okay, so what is the cause of this? So what they did an autopsy of cats who drank pasteurized milk. With unpasteurized, they are well behaved. With pasteurized, they are rotten. Rotten brain. They found out their brain is damaged by milk. Pasteurization. Their liver is damaged by the milk. Their heart damaged, the kidney damaged, and gastrointestinal problem. You could see, just heating the milk change the composition of the milk. That's why breast milk is the best for baby. Because it's unpasteurized, right? But the moment the breast milk is pasteurized, the baby will become sick. Now I'll explain to you. This milk contains all the antibodies to fight all diseases. Tuberculosis, it's there. Anti-TB, anti-Hep B, anti-HIV, H1N1, everything you need under the sun. So that's why the baby is breastfed, all the antibodies are given to the baby. But if the baby takes formula milk, no more antibodies from the body. So the baby becomes sick. Okay? Suppose this is the structure of the antibody. It has, the protein structure has what we call hydrogen bond. That is weak bond. If the milk is heated, the hydrogen bond splits and the protein structure separates. It's no longer the original protein. And that's what we call protein denaturation. If the milk is denatured, the result, all the antibodies are gone. How many? Hundreds and thousands. All for all diseases. Can you imagine, right? You have lost. Okay? A lot of antibodies that will fight all diseases, including TB.
Now, by the way, why do they pasteurize milk? Their purpose is to kill bad bacteria. Yes, pasteurization kills bad bacteria, but it also totally kills all the good bacteria, probiotic. Okay? And it does not kill certain bacteria, like tuberculosis, typhoid, angular fever of cattle coming from cattle. They are killed only at 100 degrees centigrade. So what is left in unpasteurized milk? In pasteurized milk are bad bacteria, no longer good. The purpose of the good bacteria is to prevent the growth of bad bacteria. Okay, now, what changes happen? The antibodies are destroyed. And what is bad? The antibodies can become autoimmune antibodies. What do you know autoimmune? It will destroy you. It will destroy you. Cause rheumatoid arthritis, bronchial asthma, systemic lupus erythematosus, cause diabetic type 1. Okay? Destroy the pancreas. So you could see, when the milk is heated, all the good things about antibodies are gone. Another thing, unheated milk contains enzymes. Hundreds of enzymes are there to empower the heart so that it can pump, to empower the liver so that it can detoxify, to empower the kidney so that it can eliminate waste, to empower your thinking, to empower your muscle. But all these enzymes are gone if the milk is heated. Example, one enzyme. Why? Enzymes are destroyed at the temperature of 67 degrees centigrade. Remember, pasteurization is 75. So all the enzymes are gone. One enzyme, phosphatase. The enzyme phosphatase is very important for calcium to be incorporated into the bone. If the milk is heated, this enzyme is destroyed, calcium will not be incorporated into the bone. Okay? It can find its way into the arteries to cause metastatic calcification, and that is bad. It can clog the arteries. Okay? Then other things that are lost, vitamin C, flavonoids, they are totally destroyed. And certain vitamin B, example, B6, pyridoxine. If B6 falls level in the fetus, in the child is susceptible to what you call convulsion, febrile convulsion. Kaya pag nag-temperature ng 40, magkukumbal siya kasi kulang siya sa B6. But all of these vitamins are destroyed by heating. Another one that is destroyed is B12, cyanocobalamin. If it is destroyed, the child becomes very weak, no more power. Could you see the difference between pasteurized and unpasteurized? So give your baby breast milk. If there is no breast milk, give them unpasteurized milk. That will be better. Okay. Another thing with the milk. This milk contains all the fats or the cream. Remember, a lot of nagkaroon ng craze about non-fat milk, right? Everybody is now drinking non-fat milk, right? We thought it's the right thing to take, right? So that's why the whole world begin to follow that. Full cream milk is bad because it's not cholesterol. So everybody began drinking non-fat. So the result is this. The milk cream contains all the fat-soluble vitamins. Vitamin A for eyesight. Without vitamin A, your eyes, your cornea will be destroyed or you can become blind. Vitamin D for calcium absorption, and it is also involved in the activity of cellular immunity, the macrophages. Their growth and development depends upon vitamin D. So vitamin D is important for immunity. Then vitamin E, antioxidant, it prevents damage. And then vitamin K is involved in to prevent bleeding and also for bone formation. So without these vitamins, you will be in real trouble. Vitamin A, if you are deficient, you will get bad skin, lagi lang may eczema, lagi may fungus, lagi may irritation. You will get bad respiratory tract. Maya you will have infection, bad gastrointestinal tract, and urinary tract, and genitourinary tract with infections. So, in the presence of A, all of these are prevented. Do you understand? Okay. ADK, you get that from the cream of the milk. But you are drinking non-fat. Suppose the manufacturer puts their ADK, it won't be absorbed because ADK flows in the cream during absorption. So without the cream, ADK is thrown to the stomach. So that's the difference between full cream and non-fat. Now what about the contents of the cream? Okay, listen. The cream contains 3 ingredients to halt the progress of cancer. Sino dito may cancer? Cancer lang? At sabi nila sa akin, lahat ng dumatay may cancer.
Cancer sa bulsa.
Cancer sa bulsa. Yung bulusa may cancer sa bulsa. powerful anti-cancer. It can regress cancer in 3 stages: initiation of cancer, growth and promotion, metastasis. Whereas chemotherapy can halt cancer progress in 1 stage at a time. So CLA is very powerful. Number 2, butyric acid. It can regress cancer. Number 3, sphingomyelin. It can stop cancer. So you can see everything God has put in the milk. Right? Where? In the unpasteurized milk. In the milk pasteurized, that's not the one God is talking about. God is talking about unpasteurized milk. Now, CLA contains powerful antioxidant, anti-inflammation. So it prevents formation of atherosclerosis that will ultimately cause heart attack, stroke, kidney damage, liver damage, right? So that is CLA. It prevents. It prevents formation of atherosclerotic plaque. And then CLA, besides being anti-cancer, anti-atherosclerosis, because it's a powerful antioxidant, more powerful, no? It is an antioxidant that can scavenge superoxide, okay, or singlet oxygen. That's paralysis. Next, CLA is a powerful anti-diabetic because it will improve insulin sensitivity. Right? If you are not sensitive to insulin, your blood sugar like this. Look at the honey, right? You see the honey, right? Well, honey. Your blood sugar will remain in the artery. This is the artery. It cannot travel to the muscle to be converted to energy, nor to the liver to become glycogen. Where will the blood sugar go? It will go to your fats and to your blood vessel. The blood vessel is not controlled by insulin, so it will go to the blood vessel and clog the blood vessel. Okay, because it can be utilized by the muscle. You know? So, what you get is lipogenesis, pupunta yan sa fat tissue. Okay? Kaya, pag ikaw ay non-fat, wala kang CLA, patabang ka ng patabang. So it's like this. Since they promoted non-fat milk in America, they thought non-fat milk will reduce the incidence of obesity, diabetes, cancer, and so on. Dumami ang cancer. Dumami ang heart attack with the non-fat milk. Remember, the CLA is there to prevent heart attack. The CLA is there to prevent diabetes because it will improve insulin sensitivity. Look at the effect, another effect of CLA. They told you, drink non-fat milk so that you won't become obese. Balik that ang nangyari. So everybody began drinking non-fat milk. The result was a lot of diabetes and a lot of obesity. Why? How? In the fat cells, there are hormones called leptin. Leptin finds its way to the hypothalamus in the brain to suppress the appetite center. But the leptin effect is inadequate without CLA. So CLA is the one that enhances leptin effect. Without CLA, you don't have leptin effect. You can suppress your appetite every hour. Gutom ka. Kain ka ng carbo and so on. Pataba ka. So the Americans became predisposed to cancer, heart attack, stroke, diabetes, and obesity because of non-fat. It's exactly the opposite. You go to the mall, you can find people, they not even go out of the door. Sobrang tamaan. Right? Wala kang pinapatamaan. Bato-bato sa langit ang tamaan, hindi pinatamaan. Okay. So if you don't like to become obese, diabetic, you need to drink full treatment, especially on pasteurized. Okay? Another effect. So, tapos na tayo sa CLA. Next is butyric acid. Well, here. Butyric acid is from butter fat. Diba? They also ban the use of butter fat. They said, stop taking butter fat, now take margarine. And the result was catastrophic. The increased incidence of heart attack, stroke, cancer, and everything because of the rebellion against butter. Butter is in the Bible that was served by Abraham when he was visited with the Lord. In Genesis chapter 18, Abraham was visited by 3 angels, and one of them is the angel of the Lord. So that angel of the Lord is Jesus Christ. And then Abraham said, Lord, don't leave before I'm able to serve you. So, anong ginawa ni Abraham? Gumawa siya ng butter, cheese, carbs, butter, at saka fatted calf. Ang binigay niya, hindi lean meat, fatted calf. Because nandun sa fat ang CLA. The meat contains CLA, red meat. And the CLA can battle cancer, can prevent stroke, can prevent heart attack. And the meat contains a lot of antioxidants. What is that? Carnosine, superpower, more superpower than glutathione. And carnitine, it will improve breakdown of the fats so that you will lose a lot of fats. And all of these are in the CLA, in the red meat, and in the milk. And since the fat of the milk, there is a movement to stop eating fats and cholesterol. So they ban all milk with the fats and milk. So because of this, there is something I said catastrophe. So you can see, you cannot get your carnosine from the red meat. You cannot get your carnitine from the red meat. You cannot get your CLA from the red meat. Okay? So you're losing a lot of way to fight and prevent all diseases. Now, what about butter, butyric acid? It is also a powerful anti-cancer. It is found in butter. Remember, it was banned a long time ago, and they were told to eat, spend hydrogenated fats. And that is catastrophic. The three common denominators of diseases are the following: sugar, excess carbohydrate, the pyramid diet. Pangalawa, polyunsaturated fatty acid. Pangatlo, trans fat or margarine. But that was the one embraced long time ago by the American Heart Association, and it's exactly the opposite of what is good for you. So you understand? So what are the butter preparations available? If you are in the land, nasa lupa kayo, kumain kayo ng wings na. If you are in the ship, kumain kayo ng ampo. If you belong to Malacanang, you eat President's butter. Okay? Anong gusto niyo? Mabahala na kayo, anong gusto niyo? But you should eat only 100% pure butter. Kasi like amphor, it has family spread amphor which contains polyunsaturated also more ingredient. Okay? Now, what's the effect of butter? You will shock that this milk contains superpower anti-HEPA B, anti-HIV. It's in the milk, it's in the butter, it's in the butyric acid. Butyric acid is a very powerful antiviral against HIV. Because of the ban to eat butter and the shift to the margarine, dumami ang incidence ng HIV, HEPA B, and so on. But the best treatment to counteract HIV, HEPA B, bacteria, and virus is butter. Kaya kumain na kayo ng butter everyday, mawala ka na ng appetite, at gagaling ka pa sa HEPA B at bacteria and virus. Right? Yes, but that saturated fats does not oxidize. Unsaturated oxidized and oxidized. Yes, but it doesn't. Then my middle initial is free. Robin buwa in the bottom. Nagbibigay buka. Giver, life-giving. As a reflection of the life of the Lord. Okay? The polyunsaturated fats in the body should be at least about 4% of the total calories. 2% for the omega-3 fatty acid, 2% for other polyunsaturates, corn oil. And if you go beyond that, you will disturb the body's equilibrium and you will cause disease. As right now, instead of giving only 4% polyunsaturated fat, the diet of the American right now is 30% of the calories is polyunsaturated. That's too high. And it can cause cancer, heart attack, stroke, brain damage, liver damage. Liver will be damaged by polyunsaturated. Right? So you could see, even though it's omega-3, even though it's corn oil, canola, an excess of that is dangerous. Okay? Another effect of butyric acid. In the brain, butyric acid becomes GABA. What is GABA? Gamma amino butyric acid. What is the effect of GABA? Well, it will relax you if you are under stress. You can think soundly if you are under stress. So if you are very mad already, you pull out your revolver, you are going to shoot people, you are given an injection of Valium. What is Valium? That is a drug that will enhance GABA effect. So where do you get GABA? You get that from butter. So that if babies are not fed butter, mainit ang ulo. Miski tayo, if you don't take butter, if you don't take full cream milk, we are sometimes irrational in thinking. We are mainit ang ulo. Okay, hot-headed. So we need a lot of butter so that we can relax. One time, an American patient came to me, a mother, Dr. Navarro, I'm very worried about my daughter. Why? She's so violent. If she becomes mad, she will pick up the cuchillo and do anything. Baka makasaksak siya. Very, very dangerous, right? And erratic thinking. I told her, stop giving her non-fat milk, you shift to roasted white milk. 2 weeks after, the mother told me, Dr. Rebutting, thank God, thank you. My daughter is very, very happy. You know, change of milk. Just imagine from that pasteurized milk, and the baby and the daughter became very happy. And that can happen to us. If we don't have GABA in the brain because we don't take butter, we will be sometimes irrational. When we get mad, we get mad. We cannot control ourselves. But there are people who cannot control. Afterwards, you spank somebody, afterwards, naisip mo, too late already. Kulang kayo sa GABA. Kaya gabayan nyo ang inyong sariling nutrition para gumaling nyo. Gabayan. GABA. Probably. Now, next. Another component of the milk is sphingomyelin. It's a powerful anti-cancer. But sphingomyelin is a component of the nerve fiber, myelin sheath. Without the myelin, the conduction is very slow, so you become weak. Kung ikaw lalaban sa boxing, kailangan mo mas malaki ka. You need to have a lot of sphingomyelin, so you need a lot of full cream milk. Okay. It is a powerful anti-cancer and a powerful nerve conductor. It has in conduction. Now, look at what will happen if you lack sphingomyelin. Okay. In our brain, we have the hypothalamus. That is the center for emotion, which we sometimes call animalistic center. When you get mad, you get mad. You can kill people. Nobody can stop you. But there is a higher center in the cerebrum called our conscience, and that controls the hypothalamus. So when you get mad, the conscience tells you, don't do this, don't do that. From previous experience, that's wrong. Oh, don't kill, because that is a transgression of the 10 Commandments, right? If you're a Christian, you know that. So that tells you. But if the conduction is very slow, you don't have sphingomyelin. When you're mad, you can be killing a lot of people. Nakapatay ka ng siyam na po, hindi mo pa alam. Remember? Because you cannot communicate with your high center. So that is what will happen to you if you are on a non-fat. Now, just the other day, there was a conference regarding behavior. Behaviors, they found out behavior is governed by high-fat, high cholesterol. With the high-fat, high cholesterol diet, the people become well-behaved. Another thing, on Alzheimer patients, remember Alzheimer, right? They have cognitive problems. They cannot reason, they cannot think wisely, and they cannot memorize. How do you know an Alzheimer person? Well, if he's going down, pagdating niya sa gitna, he doesn't know where is he going, up ba o baba ako. He forgot. So that's Alzheimer. Okay? What is the major problems in Alzheimer? They found out lately in other research, they found out giving Alzheimer patients high-fat, high-cholesterol diet that will reduce the LDL and increase the total cholesterol. The result was excellent. It improves their cognitive function. Okay? So, bakit dumadami ang Alzheimer? Because people are taking a lot of polyunsaturated fatty acid. It destroys the brain. Okay, now next. Hey, the Lord said, you know how to give Luke 11 to 13. You know how to give good gifts to your children. If your son asks for an egg, are you going to give him a scorpion? Do you understand the meaning? The Lord replies, if your child asks for an egg, that's good. Are you going to give him a scorpion? So what does the Lord reply? If you don't give egg to your children, your son will get sick, become very serious, and he could die as if he were bitten by a scorpion. Kaya ang dami nating kidney failure, kidney damage, liver damage, and so on. And studies shows, okay, that babies are getting kidney failure because they are fed non-fat milk. Okay, that is from studies. If babies were given full cream milk, especially breast milk, with the cream in it, no kidney failure. Remember, CLA is a powerful antioxidant. CLA is a powerful anti-inflammatory. It blocks prostaglandin E production. Okay? So, CLA is very good. And antibacterial, antivirus activity of butyric acid, right? So, if that is being given to the child is protected from all infections, from all damage of the kidney. And that's why we have so much kidney damage right now is because our children are given non-fat milk. So what did they do? They remove the cream because of war against cholesterol, and let's substitute polyunsaturated fatty acid. I told you, if polyunsaturated fatty acid goes beyond 4% of the total calories, the child will be damaged. That's why pediatric patients in America, most of them die of cancer because of the lack of polyunsaturated fatty acids. So the best breast milk is still the best for baby. If you don't have breast milk, give them unpasteurized milk or give them whey milk. Another kind of milk is whey milk. Whey. Is this in the Bible? John 4 verse 65, it says, this way, W-H-Y, I am the way, the truth, and the life. Now, it sounds like that now, but it's also in the Bible. Isaiah chapter 7 verse 14, a virgin shall give birth, and his name is Emmanuel. Sino yung nanganak? Virgin Mary. Who is the son? Emmanuel. Emmanuel is the prophetic name of the Lord. This means God is with us. Okay. What is his diet? Curds and honey he will eat. Where do you get curds? You get 10 liters of unpasteurized milk. Okay, 10 liters of this milk. Okay, you have that culture with lactobacillus bifidobacteria. Then you add rennet from the gastric juice of the fourth stomach apomasum of the cow. And the result, the milk will coagulate. And 1/10 of the milk will become curd. And that is what becomes queso. And 90% of the milk is called whey, or whey milk. If it is not yet denatured. If it is denatured powder, we call that whey powder. Okay, that is whey powder. I still call it milk if it is not denatured. And the whey milk contains what? It contains bioactive proteins and bioactive peptides. What is peptides? Okay. In the same way, in the milk, you have, by the way, I was not able to talk to you, the milk, pasteurized milk contains bioactive protein. It is also found in the whey. What are these bioactive proteins? These bioactive proteins, they are very powerful antibacteria, antivirus. You see, it can kill, it's not antibiotic, but it can kill the growth, it can inhibit the growth of bacteria and virus. Now, this bioactive protein can also, some can become glutathione in the body. But if it is heated up to pasteurization level, its capacity to convert into glutathione is lost. Even the bioactive protein, the capacity to kill bacteria and virus, they are lost by heating at 75 degrees centigrade. Okay? Now, this whey contains bioactive proteins and peptides. What are peptides? Peptides, incomplete digestion of protein, the result is peptide. Example, 2 amino acids joined together, not yet completely digested. It could be alanine, histidine, and that is carnosine. You find that in milk, in meat, and in whey, and in liver. And what is carnosine? It is a superpower antioxidant. It is called universal antioxidant. Glutathione is master. Why is carnosine universal? Besides its power as an antioxidant, it has an effect on what we call age. In diabetic patients, because of the high blood sugar, they produce that age. Advanced glycosylated end product. This age product is a combination of glucose and protein, and such combination will destroy the body. It's like an oxidant. And only carnosine can neutralize age. And carnosine can also neutralize the side effects of drinking alcohol. With the alcohol, you produce aldehydes and malonaldehydes. These malonaldehydes convert bad. Malonaldehyde is so bad, it will destroy your liver. And only carnosine can reverse that. And where do you get carnosine? You get that from red meat. You get that from whey. Okay? You can even get that from egg. So a lot of things are lost because of fear of cholesterol. Okay? Next, this egg is rich in choline. Okay? What is the role of choline? Okay? Young animals were given complete foods, fats, protein, carbohydrate. Isa lang ang tinanggal, choline. On the 7th day, all these young cows died. When they did an autopsy, the cause of death is kidney failure. You see, just a deficiency of choline can cause kidney failure. So they repeated the experiment, again without choline. On the 6th day, they gave 1,000 milligrams of choline because the animals were dying already. None died, all survived. Where do you get 1,000 milligrams of choline? from 4 egg yolk. Not white, egg yolk. And this is banned almost in most hospitals throughout the world. Because of your cholesterol, you get choline from 4 egg yolk. Now, what is the effect of choline? Okay, listen to this. Choline becomes phosphatidylcholine in the body. What does it do? Phosphatidylcholine prevents atherosclerosis. It can reverse atherosclerosis. It is only phosphatidylcholine to produce LCAT enzyme, lecithin, choline, LCAT enzymes to produce HDL. So you can produce HDL, which you call good cholesterol, through choline. And where do you get choline? You get that from egg, you get that from liver, you get that from bone marrow, you get that from brain. And all of these are banned, almost banned right now because of the fear of cholesterol. So the fear of cholesterol has no scientific basis. Now what will choline do as phosphatidylcholine? It will remove the clot in the brain. It will prevent stroke. As phosphatidylcholine, it will remove the clot in the heart. It will prevent heart attack. As phosphatidylcholine, it will remove the clot in the kidney. It will reverse kidney damage. That's why it will reverse that in my kidney. As phosphatidylcholine, it will remove all the fats in the liver. It will prevent fatty liver. It will prevent cirrhosis and so on. And the liver can function to detoxify the body, to remove carnosine in the body. That's why phosphatidylcholine is also anti-cancer. And study shows phosphatidylcholine, besides its capacity to produce HDL, it is also excellent as antioxidant. It prevents damage like glutathione. Where do you get choline? You get that from egg. Shocking, right? And then what more do you get from egg? You get the cysteine amino acid. Egg is the highest. What is cysteine amino acid? It converts into glutathione. And what is glutathione? It makes you young? Yes, that is only. But it prevents damage, it reverses damage. Damage liver, damage kidney, damage brain, everything can be reversed by glutathione. And glutathione in the liver can become glutathione peroxidase. What is the job of glutathione peroxidase? It will totally eliminate all toxic metals, mercury, arsenic, lead, cadmium. It will chelate all these toxic metals and detoxify drugs that you have taken and detoxify pesticides that you have inhaled. And where do you get that from? Glutathione peroxidase. And where do you get glutathione? From egg again. That's why if you eat, that shows that eating 3 eggs a day reduce your small LDL. By the way, latest research shows there are 2 kinds of LDL. There's the large, which is good, and the small, which is oxidizing. And they found out eating 3 to 6 eggs a day will lower the small LDL that you are protected from heart attack and so on. Do you understand? And eating eggs, eating fats, saturated fats, your question, the latest that saturated fats will increase LDL and increase HDL. The HDL is what we call the good cholesterol. The large LDL is the one increased, so they are both good by eating saturated fats. That's the latest study. Okay? But if you take trans fat and polyunsaturated, they could lower your HDL, and that is disaster. Carbohydrates lower HDL, and that is disaster. So what are the 3 common denominators of sickness right now? High carbo diet, pyramid diet, high polyunsaturated, and high trans fat. All will cause a fall in HDL. But butter, cheese, egg, red meat, they will increase the HDL and LDL. And the LDL that is increased are the large, which are protected. What I'm doing right now is a postgraduate course in medicine. I hope many people will read this. Many on the medical lines, like doctors, nurses, even pharmaceuticals, and even PT and caregivers should listen to this message, because I really made it so complete that people will have to think twice. Now, another component of egg, very fat. Choline, lecithin, phosphatidylcholine, cysteine, highest source of cysteine that converts to glutathione. None can compete with egg in its capacity to produce glutathione in the body, and also whey milk. These are the most superpowers regarding glutathione. Okay. Egg contains 400 carotenoids. Remember beta-carotene? Oh, that's only one of the carotenoids. And these 400 carotenoids will prevent cancer, will prevent damage, will prevent, as antioxidant, will prevent heart attack, stroke, and cancer. Do you understand? Now, the Lord said it's very clear. You know how to give good gifts to your children. If your son asks for an egg, are you going to give him a scorpion? So the Lord implied, if you don't give egg, he will get sick and die, as if he were bitten by a scorpion, because egg is the most powerful food that God is giving to us. It prevents all diseases. Skin, beautiful skin, you need egg because of its glutathione effect. Okay? Thinking process, you need egg because it becomes acetylcholine. What is acetylcholine? Look at this. From choline, you can produce by acetylation acetylcholine. Remember, if you are stressed, your brain releases a hormone, stress hormone, adrenaline. And adrenaline will increase your heart rate, increase your blood pressure. What will block this is acetylcholine from egg. So you can relax, your blood pressure will fall. So if you eat eggs, your blood pressure will normalize. Even diabetic patients will normalize this. So egg is good for all diseases, just like milk and honey. The Lord also said, look at the wild honey. Right? Why spend your money for something that does not pay? Why not buy milk and wine? Now look at this. Milk again, now this time wine. How do you produce wine? You get grape juice, you ferment that with yeast. And the result is wine. Here in the Philippines, wine that we have is tuba or basi, right? Now, what makes wine so powerful? It is the yeast in the wine. Okay, does God recommend wine in the Bible? Okay, yes, he said, why not buy milk and wine? Isaiah 25 verse 6. The Lord said, on this mountain I will make a great feast. What mountain is he talking about? That mountain is in Jerusalem, Mount Zion. What is in the mountain? In Jerusalem, Mount Zion. The temple of God. Remember, in the Old Testament, God's dwelling place is in Jerusalem because there is where the temple of God, right? So when the Lord says, on this mountain I will make a great feast, he's preparing to what nation? To the Israelites, right? But in 70 AD, the temple of God was destroyed totally by the Roman Empire. So God no longer dwells in a physical temple. He now dwells on a spiritual temple. In the Old Testament, the Holy City is exclusively Jerusalem. In the New Testament, the Holy City is the New Jerusalem. Where is now the New Jerusalem? In the body. Wherever you find Christians throughout the world, that is part of the New Jerusalem. Sa palagay ko lang, trabaho ng OFW to spread Christianity. Oh, Christian yan, right? So, okay, now Jerusalem is worldwide, is now called New Jerusalem. You understand? So when the Lord says, on this mountain I will make a great feast, that is a metaphor for the New Jerusalem. So kasama na tayo. What is the feast of God? A feast of wine on the list. What is that wine on the list? Wine that is fully fermented and fully aged. So that is the best wine. And of fat things, beef belly, full of CLA, right? Full of bone marrow, bulalo, full of stem cell enhancing effect, right? So you will be shocked. God's party is only wine, beef belly, mga taba-taba, at saka bulalo. Bone marrow. Who said that? Si Dr. Bone marrow. The yeast found in beer making, and the yeast found in wine making, and the yeast found in bread making, they are of the same species, Saccharomyces cerevisiae. Is a species, right? Okay? So what is the purpose of the yeast? The yeast will produce a lot of essential amino acids. You cannot produce an antibody if you lack an amino acid. You cannot fight cancer if you lack amino acids. So the yeast will help you fight. You cannot repair if you lack essential amino acids. So the yeast will supply all the missing essential amino acids, right? And so you can produce antibody, you can fight cancer. By the way, if cancer are immortal cells, but if they eat yeast, the cancer cells will go on top of the Jones Bridge, and then Jones Bridge, and they will jump to the plastic figure. Cancer will commit suicide. And that's called apoptosis. So you see the good thing about brewer's yeast, that's why we have here. That's why since cancer commits suicide with vetiver and brewer's yeast, ang tingin ng cancer sa brewer's yeast is bruha. This is full wheat bread. This full wheat bread is 100% full wheat bread. 100% ang ginamit dito is saturated fat, butter. Remember, polysaccharide fat is dangerous. Especially if you have cancer, you can take polysaccharide. Corn oil, canola will promote growth of cancer. Okay? Corn oil, canola will kill your liver cells, create apoptosis. Butter, liver cells will live. So this contains 100% whole wheat bread. What is the difference between 100% whole wheat bread and white bread? White bread is devoid of 40 nutrients, and these 40 nutrients are here in the whole wheat bread. That's the difference. After whole wheat flour is milked completely, you get white flour. So what is used for bread making? Example, pandesal. Pandesal is made up of what? White flour plus, anong ginamit lang? Butter? No. They use margarine. Okay? Margarine is one of the common denominator of sickness, right? So, margarine. With pandesal, if you eat pandesal every day, magdasal ka na. So, this is wheat bread. Now, another component of whole wheat bread is wheat germ. Wheat germ is found in whole wheat bread, but it is not found in white bread. So, what is the power of wheat germ? Okay, two sets of rats. This is from the Journal of Nutrition. One set was given wheat germ, the other set was not fed wheat germ. The result is this. Those not fed wheat germ develop serious infection. They were injected with deadly bacteria. Okay? Those not given wheat germ develop serious infection. Those given wheat germ develop mild infection and all survive. So what is in the wheat germ? Is it an antibiotic? It looks like it, but it's not an antibiotic because you put the bacteria will live. So it's not an antibiotic. But wheat germ contains all the nutrients needed to produce antibodies against cancer, Hep B, and so on. Now, lastly, remember our topic is the biblical basis of health, right? The Lord said to the apostles, "Eat, this is my body." So he was offering them bread to eat. But he used bread as a metaphor, symbolic of his body. That is in Matthew 46, verse 46. Now in John 6, verse 47, the Lord said, "Your fathers ate manna in the wilderness, but they are dead. I am the manna that came down from heaven. I am the living manna. I am the bread of life. Whoever eats this bread will live forever." Okay? So what the Lord is saying is a metaphor, which means if you follow me as your Lord and Master, you will live forever. That's what he means, right? Eating bread means accepting Jesus Christ as your Lord and Master. That's the meaning of that, right? And following everything that he says. Okay. But he used bread as a metaphor for longevity. The people of old, they drank milk. They ate honey. They ate eggs. And they ate wheat bread. And they lived for 900 years. Why? Whole wheat bread is connected with longevity. In the whole Asia, nobody gets well of Hep B. You know that, right? But in my clinic and abroad, among white Caucasians, within 3 to 6 months, they are already negative of Hep B. Why? Because they eat whole wheat bread. So this whole wheat bread is super powerful. So let's look at it. Compare it with rice grain. Rice grain is 10% protein. Okay. Wheat grain is 13% protein. The higher the protein, the more antibodies can be produced. The higher the protein, the more repair can be done. Okay? So obvious, right? But rice grain is deficient. Rice protein is deficient in 2 essential amino acids, lysine and methionine. Even a deficiency of 1 essential amino acid, the rice protein is useless. It will be thrown out as uric acid. If it is complete, it will become part of the muscle and organs. If it is incomplete, 1 essential amino acid is missing, everything becomes basura. You understand? The same is true with the wheat grain. A deficiency still exists, like lysine and methionine. But if the wheat grain is converted into bread, you apply their yeast. And the yeast, baker's yeast, will contribute the missing element. And the bread becomes super powerful. So how do you eat this bread? You need 2 slices 3 times a day. Okay? Put their butter. Remember, butter contains CLA, contains antibacterial, contains even antivirus, right? If you like to toast it a little, and then you add wild honey, and you put cheese. Remember, cheese contains CLA, Also, right? And prevention of heart attack and stroke. So, you have everything to prevent heart attack, stroke, cancer, and so on, with just eating bread. And the bread is full of antioxidant power, which is in my lecture about these things. So, you need 2 slices 3 times a day. Anong klaseng keso? You can buy, if you are a basketball player, you can buy queso de bola. Okay. Okay, kung ikaw nagtatanim sa pinyahan, ang gamitin mo, tatapin pinya. Okay. You can also buy cheese from the frozen section because they don't contain preservative. Okay? As much as possible, avoid cheese with preservative in the shell. Okay. Now, how many bread do you need? You need at least 3 loaves for 2 weeks. How many liters of milk? You need at least 10 liters for 2 weeks. Put this in the freezer. It will last 1 month. Put the milk in the freezer. This one, it will last until second coming. It is when on Feast of Trumpets, 7th month, 2027. Second coming. So that's all about biblical basis of health, and wish you all good health coming from the Lord Jesus Christ. God bless.